Hello everyone, welcome to my channel Dr. Neetu Modgil ENT. Today I want to talk about allergic rhinitis. Allergic rhinitis is a disease which is just like blood pressure and sugar, which we can only control, we cannot cure it. Now what is allergic rhinitis? It is the symptoms which happens due to some allergens outside. There are 2000 allergens which is beyond the realms of this video to explain, but just a small understanding that home dust, dust on your mats, on your curtains, on your fans, on everything in the house, as well as some seasonal changes, some hormonal changes, some food and pollens outside when you go somewhere, and the dust outside the house also. These are the common allergens which patients suffer. And symptoms of allergic rhinitis is they specifically get up in the morning with running nose, sneezing, blockage in the nose, headache, itching in the eyes, watering eyes, itching in the ears and itching in the throat. They can present with few of the symptoms or all of the symptoms. It remains for an hour and then they start feeling good after some time, and it happens either 2 to 3 months a year or maybe for the whole of the year. So this is called allergic rhinitis. So how we suffer the allergic rhinitis? We are not born with certain type of symptoms in the childhood, but then patients, mostly 70% to 60% patients are prone to allergic rhinitis. This is called genetic predisposition, which they present later in life, like 20 years, 30 years, 40 years of age. And some patients, some changes in the bodies like vitamin D deficiency, not taking regular diet, vitamin C deficiency, and then there is pH change in the body, sleeping habits, more alcohol, more cigarette, and maybe some exposure to the dust and wood dust because of the construction in or outside your house. So these are some temporary reasons due to which they suffer the allergy. So how to treat the allergy? First and the foremost thing we have to remember that this is something which we can only control, we cannot cure. So how to control allergic rhinitis? First is we need to see that what is exactly causing the allergy. So is it the dust outside, it is change in season, or it is you have to observe yourself. Is there any food article which I eat and then I suffer next day in the morning? Your observation is your treatment. So once you observe yourself properly, then we can treat you better. So keeping yourself away from those allergens is the first hand treatment. Apart from that, sometimes it is beyond our realms to control the allergens outside. We cannot stop breathing, we cannot stop ourselves exposed to the changes in the temperature due to seasonal changes and all. In those cases, we can give you nasal sprays. It will control till the time you are taking the nasal spray, but once you stop the nasal spray, next season or maybe after stopping the spray, you will again suffer the allergic rhinitis symptoms. So take home message from this video is dusting of the house with the wet cloth, because with dry cloth you can spread the dust everywhere. Regular dusting of the house, regular cleaning of the mat, your curtains, your bed sheets, bed covers. Don't keep sofas which attract more dust, and all of the house you have to take care of the furniture and the wood in certain way that they do not attract more dust. Very important point, when we get up in the morning, we have a habit to open our windows and doors. I will prefer the patients who have very perennial or very high symptoms of allergic rhinitis. They should not expose themselves to the outside environment till 9 AM. Though we say that morning walk is good, but for the time then they suffer more. And then keep yourself properly replenished with vitamin D, vitamin C. Have a regular sleep at regular time and get up at regular time. Regular eating habits, same time, and keep a proportion of acidic to alkaline food, 30% ratio 70%, means 30% of the diet should be acidic, 70% of the diet should be alkaline. So maintaining a proper diet, sleep habits and the cleanliness around here will definitely control the allergy to 60 to 70%. If you are not controlling, then you may suffer with allergic rhinitis leading to the allergic sinusitis, which definitely will be more difficult to treat, and you may have to live with these symptoms. So when you have these symptoms, better you consult a doctor to get the idea that how much are you suffering and how can you control it and how can we help you with the sprays and tablets, and otherwise this video can help you to a certain extent. Thank you so much.